Hello, my name is Rodney Madison, and this is my presentation for long-term effects of mental and emotional abuse. I go to Grand Canyon University. This is for the course of childhood and adolescent trauma, taught by Professor Cindy Murphy, due on July 17th, 2024. The introduction for my presentation is going to go through the impact of childhood emotional abuse, challenges in identification versus physical abuse, long-term effects on adult relationships, importance of understanding developmental trauma, scope of the presentation on emotional abuse impact. So first, I would like to mention understanding the impact of childhood emotional abuse, explicitly considering its challenges and identification compared to physical abuse. Unlike physical abuse, emotional abuse in most cases goes undetected or unrecognized, and thus can have long-term impacts on the nature of adult relationships. Some effects are problems of attachment and self-organizing related to couple bonding and trust, as well as impaired access to emotional closeness. In the presentation, I intend to focus on such factors and stress the importance of developmental trauma and adult relational models. By exploring these dynamics, one can understand the vastness of the problem related to emotional abuse and its consequences for a person at different stages of life. The next slide is on the impact on adult relationships, which goes through trust issues and emotional barriers, communication difficulties and conflict patterns, attachment insecurities affecting relationships, the role of emotional regulation in partnerships, and the influence on intimacy and relationship stability. So the childhood emotional abuse plays a vital role in adult relationships as it affects the perception and interaction in intimate combining. Trust must also be a problematic area for survivors stemming from early experiences of betrayal or emotional neglect. Interpersonal communication, especially in close relationships, is also a complex process since it involves a lot of misconceptions and destructive conflicts. Specifically, attachment insecurities that are derived from childhood emotional abuse and neglect affect people's positive and negative ways toward intimacy and dependency. And also, the self-regulation of emotions can be impaired, causing difficulties related to stress and emotional regulations with close relationships. And all these lead to instability and issues in meeting and maintaining healthy, loving relationships. The next slide is about the interventions for providers, which I would like to point out the early identification through trauma-informed screening, therapy strategies for healing relational wounds, and support groups for survivors and partners, and educational workshops on healthy relationships, as well as collaboration with community resources. For the providers, timely recognition of the presence of emotional abuse through trauma-informed screening is vital to provide interventions. Cognitive and attachment restoration models that include methods of resolving interpersonal betrayal are valuable in facilitating survivors' treatment. It is recommended that both the victim and his or her partner should attend self-help groups to help them share traumatic experiences and work toward healing relations. And educational workshops on healthy relationships can give survivors the skills to handle issues that may hinder mutual understanding with their spouses. Collaboration with community resources is essential to provide well-rounded care beyond the client session. The next strategy is about strategies for resiliency, which I'd like to point out is focused on building healthy coping mechanisms, developing assertiveness and boundary setting, cultivating supportive social group networks, mindfulness and stress management techniques, promoting self-care practices, and promoting resilience among survivors of childhood emotional abuse fosters the development of healthy ways of coping. This also entails over skills and anger management, aggressiveness, and establishing personal barriers. Thus, positive social actions can help affirm, encourage, and even get help from them during the most challenging moments in life. Self-compassion and coping skills in adult learners are considered helpful exercises in managing stress and anxiety and increasing self-awareness. Promoting self-care practices strengthens clients in the aspects of recognizing their own needs and rebuilding themselves each time they are faced with difficulties. To conclude this presentation, I'd like to point out the advocacy for trauma-informed care, importance of ongoing support and therapy, and empowering survivors through resilience building, and a call to action for systemic awareness and change, and resources for further information and assistance. In conclusion, it is imperative to promote the ideas of trauma-sensitive care by exploring the consequences of childhood emotional abuse on adult relationships. Ongoing support and therapy are critical as they assist the patients in recovering and regaining control of their lives. I believe that emphasizing the concepts that build a person's endurance will provide that person with the necessary tools to overcome the impact of emotional trauma, and the implication of the call to action calls for awareness and reform of the system as the best practice that stand to benefit from policy reforms and changes embrace trauma-informed care and health and education facilities. Resources for further information and assistance ensure continued support for individuals affected by childhood emotional abuse and promote a community-wide commitment to fostering healing and resilience. This concludes my presentation. Thank you for listening.